Hi, everybody. My name's Karen. I'm sorry, I've had a few technical issues and I've actually just been talking for the last 5 minutes to myself. But don't worry, I'm going to go over it all again. Now, it will probably take a few minutes for a couple of people to everyone to get on board. So I'm just going to introduce myself. My name's Karen. As you can probably see from a uniform, I work at Brisbane Plastic and Cosmetic Surgery. And the BRAS clinic stands for Breast Review After Surgery. It's a clinic that we have available to any female who has had breast implants for aesthetic or cosmetic reasons. Um, it is not a breast cancer check. So, under no circumstances are we diagnosing breast cancer, or if someone feels that they are coming to have a breast cancer check. It is not that at all. Um, it is purely to check the health of your breast implants. So the process basically is that if you are already a patient of Brisbane Plastic and Cosmetic Surgery, as part of your patient journey, you will automatically be transitioned to the clinic for your checks. It's all held at our rooms in Hamilton and our rooms at North Lakes. Um, if you are a patient who has had breast implants, oh, good, I'm on. I can probably stop babbling a little bit now and get more to it. So basically, if you have had breast implants either overseas, somewhere else in Australia, with another surgeon here in Brisbane, or with Dr. Richardson, you're welcome to come to the clinic. It is a no expense clinic, meaning that to see me in the clinic, there are no fees. You do not need a referral to come to the clinic either, so that's quite important. So you don't need to see a GP or anything like that to come in. Once you come into the clinic, if you've had a recent ultrasound, I'd like you to bring that with you so that I can review that and discuss those results with you. If you haven't had a recent ultrasound, I will organise one to be done for you. Um, and then from there, the clinic, we do like a little sort of patient history, and then we do a physical assessment. And in the physical assessment is to determine the health of your implants. Do you have any capsular contracture? Do you have any rippling? Are your implants, is the shape and size still the same from when you're 12 months after your initial surgery? And if you have any issues like that, if you're having bottoming out, are your implants sitting okay? Are they looking aesthetically pleasing? So we can determine all that. And from there, if everything is completely fine, we would just make an appointment to see you again back in the clinic in about 12 months. If there is an issue, if there's an issue with your ultrasound report, I then organise an MRI scan for you. And then if you do need a referral onto a plastic surgeon, obviously I would refer you to Dr. Richardson. Or if you did particularly want to go back to your original surgeon who did your surgery, I can organise a referral for you to go to them as well. So a few of the questions have come through in the last couple of days. So I will answer all them for you and work through them. Basically, it is free. There's no out-of-pocket expenses. You don't need a GP referral. You can come to the clinic. Anyone who's had breast implants for aesthetic or cosmetic reasons can come. Just to recap on that. The clinic is actually held at the Brisbane Plastic and Cosmetic Surgery at our rooms there at Hamilton, Racecourse Road. And also we have a clinic, a satellite clinic at North Lakes, which is up sort of like on the way towards the Sunshine Coast. So if you need to make an appointment, you can contact our website online. We have an online submission form. Or you can actually email me directly if you need to ask me any questions. So even at the end of this little live talk tonight, if you have any questions that you want to follow up, or you want to ask my opinion, I'm more than happy for you to contact me via email. Now, so if something is wrong with your implants, it depends exactly what is wrong with your implants. So obviously, if it's a shape sort of issue, if you have rippling, if you have bottoming out, if you have capsular contracture, that sort of involves more a surgical intervention. So I would obviously have to refer you to a plastic surgeon, therefore Dr. Richardson, as I said, or I can refer you back to the surgeon plastic surgeon who performed your original procedure. Um, if it is something like some swelling or an unusual amount of fluid that's in your breast or in your axilla, we would then send you for further testing, such as an MRI scan and probably an FNA to test that fluid to see what that is. So to eliminate, you know, like elimination process that way. Um, if there was an issue with your breast implants and you did need them either further surgery or need to replace and you didn't have private health insurance or you couldn't afford it, this is one of the questions that came through, we could refer you to the public hospital. Obviously, you know, you would not be treated immediately because it is a public hospital, but that's why we have a great public system that we could refer you there if you have any out of if you need to have out-of-pocket expenses that you can't afford. We don't actually have any Sydney-based clinics. Lee has just come in and asked us that. We are only based here in Brisbane. So, yes, unfortunately, I'm sorry, but even though maybe I should float that idea, I could do like a little satellite clinic. No, we'll have to go that later. Now, some of the other questions, how often you should have your implants checked. We recommend that from your date of surgery, you should have your implants checked every 1 to 2 years. And at that initial 1 to 2 year mark, you should have a routine ultrasound check of your breasts and of your bilateral axillas, your armpits. After that, we are then seeing patients back in our clinic every 12 months just for a regular check, just so we can keep an eye on things, you know, make sure there's nothing untoward happening, just how things are going. Because often, depending on when you have your breast implants done, you can have a lot of changes throughout your life. There can be weight gain, there can be weight loss, there can be pregnancy. You know, so those issues that we can, you know, look at the aging process as well. So as a clinic is a no out-of-pocket expense, you can always come back and see us every 12 months. Now, I think I pretty much explained the process, but if anyone missed it, I'm more than happy to go through that again. Your consultation, you know, takes about half an hour to 40 minutes. It can by the time we have a little patient history. We talk about your results, we talk about the process, we do a little physical assessment, and then if you do have any concerns, we can obviously address them all. So it, you know, can take a maximum of 40 minutes for your consultation, just to talk about everything. And obviously it can take as long as it needs to, yeah, if you have concerns that we can address. Now, in regards to implants, a really common question that we get in the clinic is, do I have to have my implants changed every 10 years? And actually, that is not the case. Decades ago, that's what we actually was the working theory, that every 10 years you're coming back to get your implants replaced. Whereas nowadays, we're saying you do not need your implants replaced unless there is a particular reason that you do. So obviously from your own personal reasons, if you want to have them replaced because you want to get bigger or something like that, or you've had changes following children or weight loss or weight gain, obviously there. But from a surgical point of view, it's only if there is a issue or a problem with your breast implants that we would then recommend you having your breast implants either removed and replaced or removed completely. So therefore, you can have your breast implants for 30 plus years. And in the clinic, I have seen patients who've had their implants for a lot longer than 35 years. I've got a lady who had implants in South Africa, for example, 37 years ago, and she's come into the clinic. There are a few other patients who might have only had their surgery within 12 months who come into the clinic. So breast implants don't necessarily have a particular lifespan. So it's not, you are not obligated to have them replaced every 12 months. Now, moving on to some of our other questions. How do you recognize if you do have an issue with one of your breast implants? So sometimes if you do have a ruptured implant, you don't actually know necessarily at the time. So sometimes it can be a change in shape or size, which can be indication. Or when you're having those routine ultrasound checks, which everyone should be having, particularly from that post 2-year surgery point. The ultrasound can often pick up if there is something if there is a little rupture or something like that with the implant. But if it does pick up that, sometimes it can actually a little bit of fold in the implant. So I've got an implant here actually, for example, and if the ultrasound sort of picks it up and it has like a little bit of a fold like that it might see, it can't always distinguish that between a fold and a rupture. So when that report would come back, I would send you for an MRI scan, which is a more accurate 3D assessment of your breast implant. Now, another question that I've received through is, how do you know when one of your breast implants are hard and one is soft? So usually, if that's the case, that's usually an indication of capsular contracture. So capsular contracture, you know, doesn't usually happen in the very short term after your breast implants. We do see it more longer term after breast implants. Um, so therefore, what it does, you can often have a small degree of capsular contracture where it will just feel a little bit hard, but it's not becoming uncomfortable. But when it becomes hard and started to change shape of your breast, and then what happens is it becomes uncomfortable and painful for activity, for sleeping, that's when you would have to look at having your breast implant removed and replaced, and obviously having that capsule removed as well at the same time. Another question I've received is about breastfeeding. So you can definitely breastfeed post implants. The majority of implants done today we're actually doing them through IMF, which is like incision under the breast at the breast fold there, and we're putting the implants under our pec muscle, or obviously we're putting them above the pec muscle. So in the past, if you're going through those peri-areolar incisions, which is around the nipple, that can affect breastfeeding if you're affecting the milk ducts. But when we're going through that fold under the breast, there's no issue at all with breastfeeding post implantation. The other question that I've received is that, therefore, if you have been breastfeeding, when's the best time to have your breast implant surgery done? And as a really coin phrase is like 3 to 6 months is like average thing. But what I would recommend is that you need to make sure that your breasts are at the size that you want them to stay. So you need to be at the weight, because obviously when you are pregnant and breastfeeding, obviously it's not, you're putting a little bit of weight all over your body and your breasts are like becoming a bit more enlarged. So you need to get yourself at your ideal weight and what your breast weight is going to be, because the last thing you want to do is be having implants put in and then like losing weight afterwards. So as long as your weight is quite stable and your breast shape has been quite stable, at that 3 to 6 month mark, that is fine to have breast augmentation surgery. Now, I have pretty much covered all of the questions that have come through. So I might just recap a little bit about, just for anyone who sort of only just logged on. Basically, BRAS clinic stands for breast review after surgery. So what that is we see patients who have had aesthetic breast surgery, so breast implants done for cosmetic reasons, not reconstructive reasons, post breast cancer. And we see them in the clinic to assess and their breast implant health. So there are breast implants, you've got no capsular contracture, you've got no rippling, you've got no pain, no change in shape, no change in size, you have no palpable lumps, you don't have any bottoming out, you've got no animation. So we're eliminating all those things and just keeping an eye to make sure that everything is okay with your implants. Because obviously now there's been a lot of talk in the media about that very rare condition that's associated with breast implants, which is ALCL. So I get a lot of patients that come to the clinic who have had surgery in the last decade who are concerned about their implants, and they just want to ask some questions about that. So I'm more than happy to see you and to ask you any questions in relation to your implants that you already have, and what the process is of monitoring them. I also see patients who may have had surgery and are just somewhere else and just a little bit unsure. They may have some pain that they, and discomfort that they have. So they come along to the clinic and we discuss that. And I will send you for an ultrasound. Obviously, depending on how that comes back, that's what we pursue from there. And then we also see our own patients who've had breast surgery with us, with Dr. Richardson, and they come to our clinic, at that sort of 6 to 12 month mark past their surgery, and then we see them back in our clinic regularly to monitor their breast implant health. Good. So if there are no questions, I think I have actually covered everything. So I don't know, Trish, did you have anything that you wanted to ask me about? I can recap again um, about the no out-of-pocket expenses. If you want to come to see the clinic or to make an appointment at the clinic, it's best to, we have an online submission form, which is at www.brasclinic, brasclinic.com.au. And you can also contact me by email at Keren, Keren, at brasclinic.com.au. So even if you are not in Brisbane or Queensland and you've got some questions that you want to ask me, I'm more than more than happy for you to pop me an email, and I will do everything I can to answer them for you and address any concerns that you have in regards to issues that you may be experiencing following your breast implant surgery. So, yes, I'm not really too sure what else to tell everybody. One question that did come through was, what are the safest implants to have? So, in regards to safety, nowadays we know that highly textured implants are the ones that are associated with ALCL. So therefore, it's to go for something that is more of a smoother surface implant. Obviously reduces that risk. And then the implant that you want to get as well is something that has a high cohesive gel. So what we mean by high cohesive gel is that when you sort of stretch the gel apart, it actually wants to come back. So it wants to stay together as one, which can be fairly important because when you have these other implants, which have like quite runny gel and this shiny surface, so when they sort of, if they do rupture, it sort of like becomes a bit liquidy, a bit runny. It doesn't want to stay together. So if you did have a rupture and then it was intercapsular, so within the capsule, obviously if it's this quite runny sort of silicone, this older technology silicone, um, if it's intracapsular, technically it's not really doing harm because it's contained within the capsule, like within the balloon of what the capsule is like, the implant's in there. But it can actually leak out through that capsule and then it becomes extracapsular. And then it can become a lot more serious because basically it can form granulomas and spread into your breast tissue that you already have there. So then it's not just a matter of removing the breast implant and the capsule, it's actually, you may have to have some of that breast tissue removed as well. So that's a lot more extensive surgery. So if you do happen to have a rupture, we do recommend that, you do sort of don't just leave it till it becomes a major problem. That should be something that should be addressed. So in regards to safety implants, we actually recommend, we use Motiva implants. They're probably the latest technology implants and they have a very good safety and efficacy profile. They've been used overseas for 10 years and they've used here in Australia for about 3 years. So they're the implants that we sort of recommend to use. But in saying what is the safest implants, it really is, as long as you should, if you're looking at having breast implant surgery, you just really shouldn't be having the highly textured breast implants. If you do have a highly textured breast implant, that doesn't mean that you have to go and get it taken out immediately. It just means that you need to be more diligent with checks. So you need to obviously perform your regular breast checks on yourself, like you should be doing every month, and identifying any lumps that you may have in your breast or your axilla. If there is a sudden onset change in shape and size, as in swelling, which means therefore there might be some fluid there, you should have an ultrasound. And then if there is a large amount of fluid or a normal amount of fluid, we need to take a sample of that fluid and then to eliminate the chance of having ALCL. So it's not really advised that we're telling everyone to get the implants out. It's just a matter of being diligent and checking yourself regularly. Good. Lovely. Now, I think that I don't really have any other questions that are coming through, and I have actually addressed all the questions that have been sent through to me. So I guess the thing I can probably talk a little bit more about breast implants themselves, and you know, I guess if you did find something wrong, what would be the next step would be. I think I've covered all that basically. If there was an issue, if you had a rupture, um, or if you had capsular contracture, you would therefore need to obviously have surgery. If you have rippling of your breast implant, that doesn't necessarily mean that you have to have it removed in place unless it's like particularly concerning you, because it's more of an aesthetic look. It's not really a safety issue. And some patients are quite concerned and say, well, will I get rippling after I have my breast implants? Um, if you're very thin and you can actually already feel your ribs, and you can feel your ribs, often once you do have your breast implants put in, you can often, you will actually see a little bit of rippling because you basically, have very thin subcutaneous layer and skin, so therefore there's not really a lot of breast tissue to cover your breast implant. Um, but that doesn't necessarily mean that it's dangerous or unsafe. It just means that, it might just be a little bit more unaesthetically pleasing to yourself. Yes. Um, so when we look at doing breast surgery, it's not just about like looking at the size, you're looking at patient characteristics. So looking at your anatomy that you have, how much breast tissue you already have, at your skin laxity. So there's a lot of factors that go into getting the results that you want to achieve, when you have a breast implant surgery. And after you have your breast implants, depending on when you have them, there's a lot of issues that go on as well that can change the shape of your breast implant. So obviously weight gain, weight loss, aging, pregnancy, breastfeeding, they can all affect the shape and the size of your breast implants as well. So, it's, yeah, so that could be issues that why you may look at wanting to get your breast implants removed and replaced down the track. Good. Now, there doesn't seem to be any other questions coming through. So, if no one has any more questions, I guess I'll just quickly recap the services that we have. Probably again, everyone's probably sick of hearing this, and how you can contact us at the surgery. So, it's a free, no out of pocket expense review clinic where you can come post aesthetic or cosmetic breast implant surgery, and we can check the health of your implants. So we do a physical assessment, we do an ultrasound for you, and then obviously after that, if there's something untoward, we just recommend that you come back to the clinic every sort of 12 months up to 2 years to have those regular checks. If there is an issue, we often follow it up with like further investigations, such as an MRI, or depending what the issue is, maybe we might have to take some fluid to, test it if we need to. That would be a very rare thing, but or if there's something more aesthetically, like you just would like bigger, or like you might need a little breast lift after breastfeeding, we refer you to a plastic surgeon. And then if you have got something like capsular contracture, implant rupture, if you've got obviously bottoming out and you've got no upper pole left, obviously things like that, they would require a referral to a plastic surgeon for treatment. And, and we would refer to a plastic surgeon in a clinic that I work in collaboration with, which is Dr. Philip Richardson. And our rooms are in Brisbane, based at Hamilton, and also at North Lakes. You can, if you'd like to make an appointment to come to the clinic, you can go, we have an online submission form at www.brasclinic.com.au, or if you are from outside of Brisbane or Queensland and you have any questions for me, you can feel free to contact me via email on Keren, Keren, at brasclinic.com.au, and I can do my best to answer any questions for you, or assist you in finding someone if you're interstate who can help you. Good, lovely. So I think that we can probably, if there's no more questions coming through, I will sign off. Okay, thank you all so much for listening. I hope you found it informative, and I hope you, if you do have any questions and you didn't really want to go on tonight, you're unable to, please don't hesitate. You can send them through to Trish, and I can get them, and I can obviously email you, or I can give the answers via Trish, and then she can like get in contact with you. Um, yeah, or as I said, please feel free to contact our clinic at any time, and we're more than happy to help. Okay, lovely. Thank you so much.